I'm Dr. Rich, teaching you about dentistry and teeth. Thanks for joining me. In this video, I'm going to teach you how to read a panoramic x-ray. So a panoramic x-ray is one of those x-rays that's typically taken either by an orthodontist, general dentist, or an oral surgeon. Usually it's used to show you your position of your wisdom teeth. So in this video, I'm going to teach you how to read a panoramic x-ray. Now, this is not a dental school type of video. This is just going to be for the average person when they go into their dentist's office and the dentist shows them their panoramic x-ray. This will just give you an idea so you kind of know what's going on in the x-ray when you look at it. So first up is how the x-ray is oriented. So the x-ray is set up so that when you look at the x-ray, it's as if you're looking at the person. So the left-hand side of the x-ray is actually going to be the person's right-hand side, and then the right-hand side of the x-ray is the person's left-hand side of their face. So it's a little bit weird to think about it that way, but it's, again, it's look at it from the dentist's perspective. It's as if they're looking at you. And then the top of the x-ray is the top part, bottom part is the bottom part. So now that we discussed how the x-ray is set up, next let's talk about what we're looking at. So the way x-rays work, anything that's very, very dense blocks the x-rays and will show up as white. So if you look closely up in here, you see all this kind of wispy white stuff. That's just because that part of the skull, there's a lot of bone between that the x-ray beam had to pass through. And then the black areas, the dark areas, that's air. So, you see down on the bottom corners, that's underneath the jawbone. That's just literally the air outside. And in the center here where there's that dark spot, that's the nose and the nasal cavities, which has air in it as well. And then in between, different materials will have different shades of gray. So even a tooth, the harder enamel part of it is going to look a lot lighter in color. The dark part in the center is the nerve space and the nerve canals going down the roots. And then the dentin, which makes up the bulk of the tooth, is kind of in between those two colors. This person in particular has no fillings or crowns, and there's no metal on any of their teeth. So if you see bright white, if you see any crowns or metal fillings, they would show up as bright white, and you would see them right away. They really stand out. I'll have another video where I'll show a case where there's more dental work in the teeth. So just so you guys can get an idea what that looks like versus just this x-ray, which is a relatively healthy young person. The only thing I see is a couple impacted wisdom teeth. So let me point out some of the bigger things that you can see on this. So first off, you'll see the entire lower jaw on the bottom there with all the teeth. You'll see the upper jaw with all the teeth. Right here in the center, this kind of dark area, that's the person's nose. So it looks a little funky on the x-ray. And then a little bit higher up on either side of the nose, what's that? Yes, it's the eyeballs. So you can see that. And then that area, kind of darker area just below the eyeballs, those are the maxillary sinuses. Those are big hollow spaces behind your cheekbones, basically. And they're right up above your upper molars, as you can see in the x-ray. So first thing, how I like to read a dental x-ray is I usually start on this pointy part. I'll start on the patient's right-hand side. So that pointy part up top here, that's called the condyle. That's basically the part of the jawbone that is the jaw joint. So I check that, make sure that looks okay. Again, this person, I'm not expecting to see any cracks or breaks in the jaw. They have no complaints. So then I look at the jaw, this kind of dark line here. That's the inferior alveolar nerve. That's the main nerve that innervates your bottom teeth. That's the nerve that gets when you have dental work done on your bottom tooth and your whole, half your lip goes numb, half your tongue. That's the nerve that gets numbed up to get that type of dental work done. So I look down, I go down, get to the teeth. I check to make sure there's nothing going on with the root tips. I'm at the root tips of the teeth. I'm looking for what are called periapical radiolucencies, or PARLs. Basically, that will show me that something's going on with the nerve of the tooth. If I see that the nerve of the teeth is, basically, it could be an abscess. In the wisdom tooth area too, I also look for any type of cyst or anything. Again, it's just going to look like a dark. This person, I don't see anything like that. So we go through. I check all of that. Make sure there's nothing going on. Make sure there's no cracks or fractures in the jawbone. And I go all the way up until I get to the other condyle. And that's pretty much the entire lower jaw. This little gray rectangle in between the teeth in the center there, that's just the bite stick that the person bites down on in the x-ray machine to hold their mouth and their jaws in the right position. Same thing on the top then. I'll look at the upper jaw and I'll do the same thing. I'll check each root tip, see if there's anything going on any of those root tips, and work my way across. So as I mentioned earlier, those two large areas above the molars are the sinuses. So you can see if something's cloudy or if there's something going on. Sometimes that'll actually show on the x-ray, but this isn't the best x-ray view to see what's in your sinus. Got to remember, this is a 2D image of a 3D object. So nowadays with the newer CBCT scans, you can actually get a really cool 3D image. This is a little bit more old school nowadays, but it's still a very valuable screening tool just to make sure nothing's going on. So in addition to this, usually I'll also take some bite wing x-rays because in order to check for cavities, because if you look close, you could see that there's a bit of overlap where the edges of the teeth, where the teeth meet each other. Looks a little whiter in there, and that's just because you have two teeth overlapping. And it's not that they overlap in real life, it's just the way the x-ray is taken. This is the machine that spins around your head slowly, and it's because of that view that it just overlaps. So this x-ray is not great. Dentists don't use this x-ray to check for cavities. I mean, if the person has a pretty big cavity, it will show up on it, and you can see it on this, but for just very small incipient cavities in between, you need bite wing x-rays to check for that. And so that's pretty much it. Again, and let me show you some other landmarks over here. You can see this kind of stuff on the side. That's a little bit of the person's spinal column that you can see there. Other x-rays, I have other x-rays that I can show you that'll show a little bit more stuff outside of just the jaw, upper and lower jaws. But again, the only thing out of the ordinary I see is the lower left wisdom tooth is horizontally impacted, and because it's up against the tooth in front of it, there's no way that tooth is going to fully erupt on its own. So that tooth, I recommend they get that tooth extracted before it causes a problem to the tooth in front of it. And then the lower right wisdom tooth is impacted as well, but this one's this one's vertically impacted. So I mean, if the person's jaw were bigger, there could possibly be a chance for it to come to further erupt and come into play. But just seeing how much bone there is covering the back half of it here, I don't believe that's going to come out either. And so again, I would recommend getting that removed as well. And since both the roots of both of those teeth are fairly close to the nerve, see the nerve down here on the right hand side, you could see the nerve over here on the left-hand side. I usually refer these out to the oral surgeon and let them remove it. Again, if they're worried that it's going to be close, they'll take a CBCT, 3D CAT scan of that area. A lot of times, though, it looks like it's real close, but a lot of times, though, the nerve is either forward or behind the tooth that we're working on. Another thing to mention, the image you see here is not true to scale, so everything on this is enlarged a little bit, usually about 25%. So, basically what that means, if you measure something that's like an inch long on the x-ray, it would be an inch and a quarter long. In the old days, too, dentists would we would use little stainless steel ball bearings. We put it in some wax, put it somewhere next to one of the person's teeth, and the ball bearing was 5 millimeters in diameter. So we take the x-ray, and then when you looked at the x-ray, you can measure that 5 millimeter ball bearing, and then from there you can use that. You can measure the tooth or whatever you're trying to do, and use that as a reference size to figure out how much space you have there. Again, nowadays that's kind of that's a little bit more an older technique. Nowadays with the digital CBCTs, the computer can figure all that out from the data that it picks up. So I hope you guys found this interesting, at least a little bit. Any questions or comments, please leave them below. As I mentioned, I have some other x-rays too. We have more interesting stuff to see in them. This is just a basic one just to get everybody kind of on the same page and just to start out, and then we'll take it from there. Any questions, please leave them below. Let me know. I try to answer every question and comment. Thank you guys so much for watching, and we'll see you in the next video.